Good afternoon, everybody, and welcome to our webinar on the brain, a guide to stroke prevention. We're so tickled that you're here today. We're going to have some fun. We're going to learn a lot, and there may be a moment or two where you suck in your breath and go, uh-oh, this is serious business. I'm your moderator, Randy Quare, and I'm a senior communications specialist at PeaceHealth. And although you can see by the picture that I'm healthy and trim and youthful looking, I did a preview look at this presentation earlier today, and I found out that my personal stroke risk is elevated, so I'm just a little bit freaked out, and I'm interested, and I'm going to be following along with you on what I can do to attack that. Now, we do want to get to know you, but not from you talking. Everyone is muted so that if we have 150 people talking at once, nobody hears anything. So everybody is muted. Don't take it personally. We will learn a lot about you through polls. We're going to have 3 different polls during this webinar. And so when you see this chalkboard that says time to vote, get ready to race to your keyboard because we're going to be asking questions about you, and we want to know about you. If you have any difficulties with this, it's simple. Just click the help button. If you're watching this on your smartphone, at the top of it, there's a little question mark. And click on that, type your message. We'll hear from you that way. If you're watching this on your desktop, just type where it says type message here, and your messages will come right to us, and we'll be able to share them with the person who's giving our presentation today. And one last thing, if you stay through the webinar to the end and enter or complete our survey, you're going to be entered in a drawing to win a free Fitbit. So that's worthwhile. Not only will you learn about your stroke risks, how to reduce them, how to get healthier, but you might win a Fitbit too that can help you in doing that. We're so excited today because our presenter is a person who is an expert in this here at PeaceHealth. Her name is Louise Jenkins. She is the manager of our stroke center. She's got a long career in emergency medicine and stroke care. She speaks all the time on this, part of the National Stroke Association, and she's a stroke survivor too. So Louise, we're not going to let you get through this seminar without sharing a little bit of the information on what it feels like to be on the wrong end of a stroke. And for some reason, you're a St. Louis Cardinals fan. What is that all about? Everybody here should be a Mariners fan. They're ahead today. Hello, Louise.
Hello, Randy. How are you? It's so good to be here.
Well,
it's good to be here.
Lay into it and let us know what you know about stroke and how we can apply that to our own personal lives.
All right. Well, as Randy said, I am a stroke survivor, so I am very passionate about stroke, and that's why I'm so excited to be here to talk to you in Stroke Awareness Month. May is Stroke Awareness Month, and the overarching goal of the month is to bring information to everyone so they understand how to reduce their risk, recognize a stroke, and then respond appropriately. So that's what we're going to go through today, the 3 R's of stroke. And can I ask a question, Randy, real quick? Can you see my screen all right?
I see your picture.
Your picture, yeah, okay, you don't see the 3 R's? Something's not working here. Well, okay, so we're going to talk about knowing the risk factors, recognizing, and responding. I see we're up for our first poll, Randy.
Mm-hmm. Well, for everybody who's listening at home, every once in a while, I don't know if you're aware of this, technology can get the better of us. We'll
yes, it does.
Just
yes,
a second.
Right.
Once we're
so
right on rolling.
Okay, right, we're caught up now. So I've already talked about what we're going to do today, and we're going to go to the next slide here. Here we go. How's that? There we go. And the first poll, Randy's going to do the first poll here.
Okay, and what is this poll, Louise?
This poll is, has anyone in your family had a stroke? And the choices are yes, no, or not sure.
Okay, and so what we're going to do here is we need people to go to their keyboards. Has anyone in your family had a stroke? Yes, no, or I don't know. And I can see in real time that about 1 out of every 10 people who are listening isn't sure. And as you might anticipate, half of the people who are with us today have a family history of stroke. So I'm going to share the results here, and you can see that 50%, half of the folks, have had a family member with stroke. 36% said no, and 14% say, I don't know. And it's important to find out that information, because it turns out that having a stroke-related history in your family does impact your own health. But Louise, you would know more about that than me, so carry on.
Absolutely. When we get to the risk factors, you're going to see how significant that is. And for 50% of us to have a family history, I think you're going to be in the same column as Randy and have some surprising numbers when we get done with this. But I want to tell you just a little bit about the impact of stroke first. There are close to 800,000 strokes a year that occur in the United States. And this can be a new stroke or a recurrent stroke. Recurrent stroke is simply if you've had one and you have another, that you're elevated risk of having another. But that's a significant amount, almost 800,000. Stroke is the #1 cause of long-term disability in the United States. Long-term disability occurs whenever a person cannot return to their former level of activities of daily living. Maybe they need help with their function, and they are unable to.
Oops.
They are unable to. Excuse me. Our technology is. There we go. There we go. They're unable to take their medicines or dress themselves without help, or they might need even more help. And there's varying levels of disability depending on how severe the stroke is. Now, it is the #4 cause of death in the United States, and it's moving close to being the #5 cause of death. Death is not usually the first thing that happens from a stroke. It's more the long-term disability. In a American Stroke Association poll, I think this was done a couple of years ago, almost 40% of people are unable to identify even one warning sign of a stroke. And when I say a warning sign, that is a symptom that can occur when a person is experiencing a stroke. The thing that's really important to remember is that your brain is your master computer. I know there's a lot of talk over the years that your heart is your master computer because it pumps the blood everywhere, but I just want to let you know that without your brain telling your heart to pump, that's not going to happen. And when you look at the schematic, everything you do, you feel, you taste, you understand, you play, you laugh, your identity, your motion, your understanding, your brain makes all of that happen. And when that particular area of your brain is damaged by a stroke or any other reason, that is the symptom that you're going to see in your body. Hope that makes sense. So let's talk about what is a stroke when I say a stroke. And there are a couple of kinds of different strokes, but in general, a stroke is when there is an injury or a blockage to a vessel and it becomes clogged, or the blood leaks out, and either one causes the area around there to not have blood supply. And blood is really important to go to all the cells of our bodies because blood is what brings oxygen and nutrients to all of our body cells. So a stroke is primarily the stoppage of flow of blood in an artery in the brain. There are 2 types of strokes. Ischemic stroke, which is the blockage of a stroke, and that's pretty high. That's close to 90%. 87 to 90% of strokes that occur are the blocked artery strokes. And then about 13% are the bleeding strokes, and those are the ones that are caused by maybe an aneurysm, you know, like the bubbles that show on an old tire, the bubbles, and they'll burst. Well, a vessel in your brain can have that same weakened area and become enlarged and leak blood or burst. But that is
Louise,
far,
is
far
one
less.
preferable to the other as far as being more dangerous? The hemorrhagic strokes are a far smaller percentage. Are they more dangerous, more deadly?
Not necessarily. They have a little
Okay.
bit of different risk factors. I will say the hemorrhagic ones, strokes take quite a bit longer for people to recover as well as they're going to recover because the blood that's in the brain has to be absorbed, and it's a whole different mechanism. But um, I don't know that one's preferable over the other. I don't think I really would want either one if I hadn't had one. So um, the risk factor for the bleeding strokes is high blood pressure. So if you have high blood pressure, it's really important to know that you have it and then control it, whether it's with diet and exercise or your prescribed medication. That's the #1 risk factor for the bleeding strokes. The risk factors for the ischemic, we're going to talk about it, and blood pressure is one of them. Um, so let's talk about the causes for this ischemic or the blocked artery. And when I talk about this, you're going to say, oh, this sounds just like a heart attack in my chest. So what happens is fatty deposit builds up on the inside of the blood vessel wall, and a plaque will break and a clot will form, and that's called a thrombus. It happens right there. The clot happens right there, and it grows big enough, and it occludes the artery, and the blood flow stops. Another way that can happen is called an embolus, and that's where the clot forms somewhere else in the body. And a really common place for a blood clot to form and break off is in a person's heart and travel to their brain and lodge in a smaller vessel. And who with heart problems is at higher risk is anyone that has an irregular heartbeat or atrial fibrillation. If you have atrial fibrillation, I'm sure your doctor has discussed that term with you, and you're probably on a blood thinner for that reason. There's several to choose from. Or someone that's had a heart attack, any kind of injury to your heart that causes your heart not to be normal. Blood can pool and clots form and break off and go north to your brain. So that's why people after these events are put on medication to help reduce that risk. It might be a blood thinner, it might be an antiplatelet. Your healthcare provider is the one who can determine what would be best for you. So the thrombus and the embolus, but they both do the same thing, they just arise from different reasons. The hemorrhagic one I already talked about. The aneurysm is the ballooning of the weakened vessel, and then the arteriovenous malformation, or called AVM. Those are usually hereditary, and those are cosmic little things, and it's where the arteries and the veins just kind of intertwine into a ball. And people can have these for years and years and years and years. They never know they have them until the artery becomes kinked or weak and has the leaking, and then it's found, and our neurosurgeons can go in and do the repair on these for most of them. So those are the two types for the hemorrhagic stroke, and both of those, the #1 risk factor is uncontrolled blood pressure.
Hmm.
And then the other type of stroke, you might have heard the term mini stroke. And a mini stroke officially is called a transient ischemic attack. And so transient means here and gone, it's here and gone. And so it's also called a TIA. And the TIA is a warning sign. It is a big red flag that this person is setting themselves up for a major stroke. Because for a TIA, the blockage occurs, and then it spontaneously opens. And then the blockage occurs, and it spontaneously opens. It's the body telling you that something's going to happen. So if a person were to have a stroke symptom and then it resolved and went away, and then it came back, and it might last for 30 seconds, or it might last for a half an hour, but it goes away. And it's called fluctuating, here and gone and here and gone. That is a medical emergency, and that person does need to get to an emergency department and be seen and placed on the right medications to try and stop a stroke from happening. So mini stroke or TIA
Louise,
is
it
that
sounds
red
to me
flag.
like a TIA is kind of a little gift that you're being given. It's a warning sign if you're wise enough to listen to it. We have warned you that you have a potentially huge problem. Do not ignore this warning.
I think
Is that
that's an
one way to look
excellent
at
way
it,
to
a
put it.
positive way?
That's an excellent way that it could be your gift, a gift of warning. Absolutely. That's a great way to look at it. So When we talk about the signs of a stroke, and it comes and goes, consider that your gift of warning. So our first R is to reduce risk factors, but we've got to know our risk factors before we can reduce them, because not everybody has every one. And so, but stroke is preventable. There's research that shows 80% of all strokes can be prevented by making healthy choices and behaviors. That's a significant amount. Here at our institution, we treat about 600 strokes a year. And if 80% of those were here, that would be quite a difference. You know, about almost 500 people would be not having strokes. There are treatments that can be done, intervened when someone's having a stroke and they come into a hospital right away. That can be emergent treatment that can limit long-term disability in a number of cases. Not everyone is eligible all the time, and we'll talk about that. But the big thing is preventing it in the first place, trying to make those changes. And Randy, it sounds like you're going to be making some changes after what you said when you first came on.
It sounds like I need to, yeah. Especially
Yeah.
watching the pictures of all of the blood rupturing and leaking through the brain. That gets your attention. Thanks for those graphic images.
It does. It right at lunchtime. Yeah, I understand. So let's look at the stroke risk card. And this is one of the attachments that you'll be able to print out and look at for yourself. And when you look at this blue column under risk factor, and it talks about blood pressure, atrial fibrillation, smoking, cholesterol, diabetes, activity, weight, doesn't that sound exactly like what your cardiologist tells you is the risk factors for heart disease? And it's true. The risk factors are pretty much identically the same, and because the heart and the brain are tied so close, and a blockage in a vessel causes muscle death at the site. Heart attack in the heart, brain attack in the brain. So how do you use this scorecard? You look at blood pressure, and you read across. And if you're greater than 140/90, or you don't know your numbers, what your blood pressure runs, you're considered high risk. So you will check a checkbox there, or if you're yellow or green, check the box appropriately. Atrial fibrillation, I talked about, is an irregular heartbeat, and clots can form in your heart. So if you're diagnosed with it, you're red. If you don't know if you have it, if you think you might, you're yellow, and if you know you don't, you're green.
Louise, what would an irregular heartbeat feel like? I mean, if a person's had an irregular heartbeat for years, it might seem normal to them.
It might seem normal to them, but an irregular heartbeat is worth being looked at.
Is it lightheadedness? How would you know?
Sometimes people complain of like a fluttering, you know, like a butterfly in their chest, like a light fluttering. It might be kind of in the sides of their neck. They feel like a fluttering, or they could be lightheaded depending on how fast their heart might speed up if it's irregular. So there might even be a little component of chest pain. That's not as great as the fluttering feeling. Or sometimes you just feel an irregular, if you know how to check your pulse. You can lay your finger on your pulse of your wrist and just feel that it's not like a two-step, you know, a nice steady two-step. It's more like that jitterbug one that jumps all over the place. So if you think you have an irregular heartbeat, it is worth talking to your doctor, and there's a test that they can do and monitors they can put on to see if it is. You do have it and need to be treated. So the next one is smoking. We all know smoking is bad for our vessels everywhere in our body, so you check the appropriate one. And then cholesterol. Here's another number you need to know. If you're greater than 240, you're red, and you can see how you go on to the yellow and the green. Diabetes is a definite risk factor for heart disease and for stroke. Physical activity. Physical activity affects many things. That will affect your weight. It will affect your cholesterol. It will affect your blood pressure. So physical activity alone is almost a medicine itself. But when you're looking at your risk factor, you check across the line there, whether you don't participate regularly or maybe 1 or 2 times a week, 3 to 4. I have to say I'm more in the yellow there. I need to kick it up a little bit. And then weight. You need to know your weight, and you need to know whether you're considered overweight, slightly overweight, or a healthy weight. And I know the charts that some of the insurance companies put out are pretty rigid, but I would talk to my healthcare provider about this too. You know, if they consider you, which column they would fit you in. And then this is the one you cannot control. If you have someone in your immediate family who has had a stroke, mom, dad, brother, sister, aunt, uncle, or grandparent. If one of them has had a stroke, you are at higher risk of having a stroke, and that is both for the hemorrhagic and the ischemic. If you don't know what your family history is, you're at least cautioned there, and if no one has, you're low risk. So let's look at one of these cards that has been filled out. And you can, there's little black X's in here. So this person has, they don't know, they either have high blood pressure or they don't know. Down the red column, their cholesterol is either elevated or they don't know. They're overweight, and one of their close relatives has had a stroke. So their total is 4. You add the column. In the caution column, they don't know if they have an irregular heartbeat. They're trying to quit smoking. They exercise 1 or 2 times a week, so they're 3 in the caution. And they do not have diabetes, so they're lucky there. So you can see the totals at the bottom. Then on the other side of this card, at the top, it kind of gives you an idea of where you fall. You know, you figure that out on the front and what you should do. This guy had a 4, or lady had a 4 in the high-risk column, so greater than 3. So they should talk to their healthcare provider immediately about a stroke prevention plan. And if the yellow, then they're elevated. They need to take control on reducing their risk, whether that involves seeing a healthcare provider or, like I said, exercising and trying to reduce the cholesterol and the blood pressure that way. And then low risk. So this is just to kind of point out your individual risk, find out if you're yellow, green, or red, and then take the next step to control those risk factors. And we're going to talk about...
I want to take a
yes.
moment to remind people that they have the opportunity, if they want to ask specific questions of you, just type in your chat window and the questions will come to us. And I also want to point out, this risk scorecard that got my attention because I had 5 in the yellow. And like I said, I thought I was doing well. But when I went down to the pharmacy a couple of weeks ago, I put my hand in the cuff because I had some time to kill, and my blood pressure came out higher than 120 and higher than 80. And that's kind of a new thing for me. And I didn't know what that meant, so I just figured, oh, it must be the machine. It's not me. It can't be me. And then I did it again a week later, and the machine was still saying high. And I realized that time is passing, and, you know, just like through age or something, you know, I moved from green to yellow. And it's really caught my attention. So I'm going to be paying closer attention to my blood pressure. And I have a gym membership, but apparently owning a gym membership doesn't lower your blood pressure. You actually have to go.
Yeah, I think you actually have to be active in that to make it work. And I will share with you, at one point before I had my stroke 22 years ago, I was red. And today I am green. I have made the lifestyle choices. I have quit smoking. I have lost weight. I have reduced my cholesterol. And it's been all through lifestyle choices and behaviors.
I was thinking when you had that list up on the previous screen, all of those different things, cholesterol, overweight, exercise, all that kind of thing, that's the list that everybody has of things that they're going to do starting tomorrow. But, you know,
January.
Yeah, I'll address my physical activity tomorrow, and my smoking,
Right.
I'll stop smoking tomorrow. And you know, if you don't start it, there's not always going to be a tomorrow.
Absolutely, absolutely. So, and most of these are controlled through your choices and behaviors. So, yes, I went from the red to the green, and I was proud of myself for that. But it's not an overnight thing that happens. You work slowly, and maybe you tackle one thing at a time. But I have to tell you, the physical activity will work on the blood pressure and the cholesterol and the weight. So I think you get three birds with one stone there. But
Yeah,
you got to use that gym membership. Yeah. Okay. So let's move on to this poll. Another poll.
All right. This is a chance for people to let us know what they think their risk is for stroke based on the scorecard. So prior to me watching your presentation, I would have thought I was in the low green, and I was very surprised that I was in the medium yellow. But we're asking the people who are in our webinar to find out what you think your level of stroke is. It would be nice if it was 100% green, but that would make this an extraordinary group. I
It
wouldn't guess
certainly
that
would.
if we got a big group like this together anywhere in America that we would have 100% green, and I'd be very surprised if we are today. So as I'm tracking, it sounds like that I am not unique or unusual in the fact that the majority of people in our poll today, 57%, are saying that they look like they are in the medium space. 30%, 3 out of 10, are in the low space, and about 13% of us are sitting here going, uh-oh, uh-oh. And that's great. I mean, just the fact that we're all taking a look at this and thinking about this together at the same time, maybe we can all agree to start doing something about it at the end of this webinar.
Honestly, that is significant. 57% yellow. So many of you have identified risk factors, and we're going to talk about a little bit about strategy to intervene on these. That's quite a poll, I have to say. And this card, like I said, it will be one of your resources. You take that and print it out and take it to your family and your friends, and you get them to look at their risk factors, because if you want to start making the change, it's much easier to do it with a buddy.
Mm-hmm.
Okay. So we're going to talk about recognizing a stroke now. We have identified our risk factors and how to start working on them a little bit. So we're going to talk about recognizing a stroke. The important thing to realize about a stroke is that it's very time sensitive. Every minute that that artery is blocked and that blood is not flowing, 2 million brain cells die. So that is significant. And the typical stroke, it has been looked at over and over and over, and research done, will keep going about, the average is 10 hours. So that is a significant amount of brain cells that die, and therefore the more brain cells that die, the larger the disability in the end. So it's so important that when someone thinks they're having a stroke, or you think someone is having a stroke, that you respond early.
Louise, I know that you have had a stroke, and I don't know if this is the appropriate time to do it. Maybe it is. While people are polling, the question is, have you ever heard of BFAST? So hit for your keyboard, and if you know what BFAST stands for, click yes, or sort of, or not, no, I'm not at all familiar with it. And while people are doing that, I want to ask you, did you recognize when you were having a stroke, or did you just say, oh, I must have eaten something that didn't agree with me, or I worked too hard today, I'm going to take a nap and I'll feel better? How was your stroke situation?
Well, I will be honest with you, and I really hate to say this, I was a flight nurse at the time, and this was for a trauma center in Missouri, and I had no idea I was having a stroke. I thought I was hypoglycemic. It was 6 a.m. in the morning, and I was getting into the shower, and I had no idea I was having a stroke. And I'll go into the details a little bit more after we talk about BFAST, okay?
Okay, very good. Well, as in our polling, about 1 out of 3 of us say yes, that they have heard of BFAST. 43% are saying sort of, because I've heard of FAST. And about 1 in 4 of us are saying, nope, not at all familiar with it. And a lot of the people that I've talked to about this have heard of FAST, but BFAST is a newer thing. And if you haven't heard of BFAST, don't feel bad, because a lot of people haven't heard of it. So the numbers again, about 40%, a little over 40% of it have heard of FAST, but only about 30% say that, yeah, they know what BFAST is. So bring us in the know.
I will. And so BFAST, the reason FAST has turned into BFAST is because when we look at FAST, that looks at the front part of our brain. It's the front 2/3 of our brain. So think FAST is the front, but by adding the BE, it looks at the back of our brain. So instead of looking at 2/3 of the brain for symptoms, it encompasses 100% of our brain. Does that make sense?
Yeah.
And so this came from the University of Utah probably 2 to 3 years ago. So it's just now coming out to the community. And so FAST has become BFAST. So let's talk about what the letters mean. So when you look for the B, that means balance. And that would be all of a sudden the person loses balance. Maybe they start kind of veering off when they walk. They might look intoxicated but not have had any alcohol. They might completely lose their balance and have to touch the floor with their hand. And that is a symptom I had when I had my stroke. It was in the back part of my brain. I went to go into the shower and I reached in to turn the water on, and all of a sudden I didn't know where my body was. I didn't know where the floor was. I was so uncoordinated. I told myself I had to lay down on the floor or I would fall, and that's what I did. So balance. It can be a little bit where a person starts becoming clumsy or complete loss of balance. So that's the B. The E stands for eyes. Does the person have a sudden change in their vision? I do want to point out that these changes are sudden. They're new. This isn't something that I didn't have that problem before. It just started all at once. And so the vision, something new, they might lose a section of their vision. It can be, part of the side. It can be some of the middle. It's not usually that it becomes blurred. It's usually a loss of vision in a part of the visual field. And then, so that's the back of the brain, the BE. Looking at the 2/3 of the front, we look at the face. Does the face become uneven? The mouth can droop down, maybe the person's eye on the side droops down, or it could be both. Then if an arm becomes suddenly weak, ask the person to hold their arms out in front of them, hold them out at 90 degrees, and look and see if they can hold them both up, or one of them slowly drifts down as a new symptom, or maybe they can't hold that arm up at all. That's a symptom of a large vessel occlusion. Speech is the S component, and there are two components to the speech. Their speaking can become slurred. Their words become where you cannot understand them. They sometimes called garbled or word salad. Or they might use the inappropriate word. They could pick up their coffee cup and think they're holding a kitten or a gate or a car if they start using inappropriate words. So when there's a problem with their speech. The other component to the speech part is their understanding of the spoken word. And that would look like if I was talking to someone and they had a stroke in the part of their brain that has to do with understanding, I should be speaking Swahili and they have no idea what I'm saying, and they might become scared because they don't understand what's going on. So speech can be either speaking it or understanding it. And then if any one or more of these symptoms is new, it's time to call 911 right now. It's time to
Louise,
call
this is
911.
important information for people to know. If you are experiencing them and you're alone, if you can look in a mirror and look at your face, or if you're with somebody, they don't know this information. And I'm thinking about this specifically because I was with my mom last year, and all of a sudden she just started saying things that made no sense to me. And I had heard of fast at that point. I didn't know be fast, but I knew fast. And I said, Mom, look at me. And she turned and she looked at me because I wanted to see if her face was droopy on one side. And her face looked normal, and I asked her to smile, and she was able to do an even smile. So I figured, okay, it's probably not a stroke. So why are you talking so crazy? And it turned out that she didn't have her hearing aids in, and she was just all confused. But
right, but you did some troubleshooting and you figured it out, right?
Yeah, because for 15 seconds there, I was afraid. I did not understand what was happening, and knowing fast at that time greatly eased my burden. So memorizing this stuff can be useful for you or somebody that you're with.
Absolutely, and if you're with a loved one and you know that they, like Randy's mother had the hearing aid, and he looked right away to see if it was there, and it took care of things, that's fine. But if he were to put her hearing aid, yes?
A question that's come in from our audience: would the loss of vision be different than what's called the aurora? I'm not sure what the aurora is. Maybe that's a medical term that means something to you. Would the loss of vision be different than the aurora?
The aurora, I'm assuming this person's talking about the colors, like rainbow colors, that you see particularly when you look at a bright light. And yes, it would be different. Loss of vision means it goes black. It goes dark in that field of vision, whether it's the right side of both eyes, or the left side, or the upper or the lower. The aurora is, what my understanding is, it's usually colors, and kind of like the what is that thing in Alaska, the aurora
The
borealis,
borealis.
the lights and the borealis, yeah. So it's colorful lights and colorful colors that people see, but it's due to the light and then degeneration within the eye itself. So it's totally different. When I say loss of vision, it's a blackout of part of the vision.
Okay, and we had one other question about seeing that list again of risk factors, and we'll have a link to that at the end of the webinar, so stay tuned and we'll show you how you can download that and print it out and hang it on your refrigerator if that's what you want to do.
And share it with everybody you care about.
Share it.
Right. Yeah, okay. So we have BFAST. We have 100% of the brain symptoms of a possible stroke. I mean, there are more symptoms possible, but these are the main ones, the most common ones. Now, this is a video that you will have the link to. It is from Stanford University. It is a great video about BFAST, B-E-F-A-S-T. It puts everything we have talked about so far into one neat little package, and it's about 2 minutes long. We're not going to play it today because we've got our time to watch here, but please, it's in your resources. Go to this web link and play this video, and then play it for all of your loved ones too. Send it out and share it. It's very much worth watching. So I want to talk about what it feels like personally to have a stroke. I had one, and mine was my balance. I completely lost my balance, and after that I never could go back and be a flight nurse. It negated my ability to be a flight nurse because of the height, and so I went back. I started being an emergency department nurse, but it took me 9 months of rehab and exercise to get back to be able to be a nurse in the emergency department. And so mine was total balance. And so I talked about some of the symptoms of the vision change, and you see right there in the middle where there's a picture of, let's say, Eiffel Tower. That must be Paris. And in the middle, the vision is missing. Well, they have white on there. Everybody has told me it's black. It's missing vision. So it's a field cut. It can be either side. It can be in the middle. It's just loss of vision. There's just nothing there. And then the little man in the upper right, weakness on one side, strength on the other, trying to hold the arms up, and it's just not staying up. Then there's those feet. I just love the picture of those feet. Tingling and numbness. That your brain makes your sensory perception everywhere in your body. And this particular picture is for peripheral neuritis, but I thought it was a good indication, a good indicator of what it would feel like to have a sensory deficit of pins and needles and like just almost numbness, a big numbness somewhere. Is what you can have. You can have that anywhere, depending on where this happens in your brain. It might be your arm, your hand, your face, your leg, your feet. And then the speaking. It's the technical name for trouble speaking is called aphasia. And there are a lot of different types of aphasia. The difficulty speaking, the difficulty understanding. Those are primarily the symptoms you will see with a stroke. There's also difficulty reading and difficulty writing. That is far, far, far less. And then there's the little smurf being clumsy, with the posterior brain. So that's kind of what my interpretation of the most common symptoms that people see can be depicted in a picture. Hope that made sense to everybody. Just kind of my thought off the moment. So let's say that I think that my friend next to me might be having a stroke, having one of those BFAST symptoms. So what do you do? Oh, well, like we said in the T part, you call 911 immediately. And one of the first things they ask you, the ED is going to ask you, the doctor's going to ask you, the nurse is going to ask you, everybody's going to ask you is, what time did these symptoms start? So try and have in your mind, try and think, when did this change start? And that is so important because the interventions that can be done to help stop a stroke in its tracks is all dependent on the time from when the symptoms started. And it's not a big time window that we have to work with. So What time did it start? Call 911 and then start thinking, what time did it start? Because you're going to be asked that many, many times. There are 2 treatments that can help with to stop a stroke in its tracks. And I want to point out that not everybody is eligible for one or both of these. That is a determination that is made by the neurologist and the neurointerventionalist and the emergency department doctor. They all have their certain expertise, and someone might come in with a stroke and it might only be an hour old, but there might be something in their history, something in the medications they're taking, something in their lab work that they cannot be eligible for this treatment. So don't think just because you're coming in that you will get this treatment, but a lot more people can get it if they came in sooner. Does that make sense? I hope so. So let's talk about the 2 treatments. And you know, on that second line there where it says they'll get life-saving treatment, I think that should be changed. They should get brain-saving treatment. So the first treatment is a clot-busting drug, a very, very, very potent blood thinner called tissue plasminogen activator, or TPA for short. And this works very, very well for strokes that occur in the smaller vessels of the brain. This drug goes right to the site and it breaks up that clot, and blood flow is restored. We've had patients that come in and they get this and they can go home the next day sometimes when it's a small vessel. But TPA alone doesn't work the best on the large vessel of the brain. And your brain has 2 large vessels. And when I say large, I'm not talking garden hose size. I'm talking maybe number 2, pencil lead size at the most. It's not that big. But when a stroke happens in a large vessel, that can lead to a very debilitating long-term disability, because everything on that one side could be affected. So the other treatment that is available, the TPA can only be given up to 3 to 4.5 hours from when the symptoms start. I forgot to tell you that. So when a person comes into an emergency department, they have to have blood work and imaging. The ED doctor sees them, the neurologist sees them. This all takes maybe 45 minutes to an hour. So when you take that off, I'm talking we got up to maybe 3 hours from when the symptoms started to get this medicine in. So that's why time is so important there. The other treatment that's available is what's called a thrombectomy, and this is where we take patients to the cath lab. Just like when someone comes in with a heart attack and they have a blocked vessel in their heart, we whisk them off to cath lab and they do a cardiac cath. Someone comes in with a large vessel occlusion, they might get the TPA, the IV TPA, if they're within that short window frame. And if it's not doing something to improve the symptoms within 10 minutes at the most, we'll get the neurointerventionalist in and the cath team in and whisk the patient over there, and just like going to the heart, but they will bypass the heart and thread the catheter on up into the brain to that large occlusion. And on that schematic, you can see it looks like a little basket. It is threaded, it is put into the middle of the clot, and then it opens up like a stent in the heart, and it kind of embeds in that clot, and flow is immediately, a portion of flow is restored to that area, and then manually this clot is removed out, pulled out, and out the groin. So that's called a thrombectomy, and that can extend the opportunity to 8 hours from when the symptoms started. So you can see when someone starts having one of these symptoms of the going to sleep of the arm and it's new and they say, I'm going to take a nap, they lay down and sleep for 2 hours and they wake up and the arm is still numb and there's no explanation for it. That's how people fall out of the time window to be eligible for one of these treatments. So that's why T is so important in the BEFAST, to be eligible for a treatment in the time window when the rest of all the cards fall in line to be eligible. Many places treat a lot of patients that come in, but by far, when I said 80% of strokes can be prevented, I would venture to say I think the thing I have read is that probably 40% more could be treated if people came within time that we can get them into one of these treatments. So be fast and be fast about it, I would say. So there's a lot of new technology available for stroke. Stroke is pretty far behind heart and cancer when it comes to research. The funds haven't been there, and it just hasn't been one of the diseases that has drawn a lot of attention until probably the last decade. It has become one of the forerunners of research, and telestroke is quite popular, and a person can go to an emergency department probably in the remotest area of Wyoming, and there will be a robot there that if the ED doctor says, I think this person's having a stroke, they roll this robot to the bedside, and within a minute, the person is talking to a neurologist. Could be in the United States, could be somewhere else in the world, but as you can see in that little picture that the patient's laying on the bed and you see the man's picture up there on that robot, that neurologist is assessing that patient. This is bringing the expert to the bedside within minutes so they can make that determination, is this patient eligible for IV TPA or maybe neurointervention, and then what do we have to do to make that happen? So it's bringing that expert right to that bedside really fast. I've already talked about the cath lab for the brain. It's the same cath lab that we use for hearts. It's the same crew, different doctor though. And it extends that precious time from 3 to 4.5 hours up to 8 in certain instances. And it opens those arteries very well. And then there's a technology called Pulsera. It is brand new. It's probably only 2 years old, and it's just coming to the Northwest, and it is a communication tool that is based in the cloud. It is communication from emergency medical services or the ambulance crew to the emergency department doctor, and all the specialists involved in time-sensitive diagnosis, which is stroke and STEMI. And the content that is exchange between these two is evidence-based, and it's limited to what the doctor needs to know to make a medical decision. So this is a new tool. It's here in the Northwest, and it's being instituted, and I'm excited to see this grow here in the Northwest so we can make even more streamlined care and get people the right resources at the right time and to have an improved outcome. So I would like to know, does anyone have any questions?
Yeah, and if there are questions that you think of at another time, like later on today or when you're in the shower or something like that, if you can email Louise at ljenkins@peacehealth.org. And this is one of her favorite topics, so she'll be more than happy to respond to your questions. That's ljenkins@peacehealth.org. And I want to let you know that there's other things that we want to share with you too. So we have a number of resources and handouts that we shared throughout the webinar today. You saw the checklist for things that can put you at high risk of stroke. These are all available if you go on the web to peacehealth.org/stroke-webinar. Again, that's peacehealth.org/stroke-webinar, and the recording of what we talked about today, that's going to be posted soon. So check back, what's today, Thursday? I would say if we don't have it up there on Monday, it's because well, Monday's a holiday, so let's shoot for Tuesday. It'll be because we had a celebratory Memorial Day weekend. You can download from there this presentation, the scorecard, the Be Fast infographic, and the whole resource list. And again, that's all going to be available online, peacehealth.org/stroke-webinar. You will also be able to sign up for things if you go to peacehealth.org/email-sign-up. I don't want to flood you with different things that you can go online to find, but peacehealth.org email sign-up will alert you to future webinars on other topics of interest, give you some brief health news, show you some special offers that will come up from time to time, and also upcoming local events. So that's worthwhile. And in just a moment, you're going to be offered the opportunity to complete a survey about the information that you got here today. Did it satisfy your questions and your needs? And if you fill that survey out, you're going to be entered into the drawing for a free Fitbit. Thank you all so much for attending. attending today. Louise, I want to thank you again. That was fascinating information, and I'm not kidding when I say as soon as I get up from my desk here, I'm going to hit the gym this afternoon, so you'll see me there. Thanks, everybody. Go to visit peacehealth.org/healthyu for all sorts of great health information. We hope to see you again at our next webinar. Bye-bye.